Should be about a 1, maybe a 1.5, a 2 if you've got kind of sensitive teeth. Scaling root planing is probably in the 3 to 4 range because sometimes you have to be numb and sometimes that tissue does have to be manipulated to get access to the things underneath the gum tissue. So you can have some soreness and some tenderness after the numbness wears off. Implants are probably in the 3 to 4 range, depending on if you had to have an extraction beforehand or if there's any kind of tissue manipulation that goes on. Just basically expect some soreness for the next couple days. X-ray should be a 1. There are some people that have bony outgrowths in their mouth called tori or have smaller mouths that make it a little bit uncomfortable. So sometimes we have to use child-sized X-rays to accommodate for those patients, but generally speaking, X-rays should be in the 1 range. Root canals fall in 2 categories. If the tooth is not painful beforehand, the amount of pain or discomfort is probably in the 2 range because you're able to get numb, remove the nerve, and everything is fine. If the tooth is infected or in a lot of pain going into the root canal, sometimes it's hard to get numb, and that can be an unpleasant experience. I would say could possibly in the 6 to 7 range in the worst case scenario. Tooth extraction, 3 to 4, depending on a lot of factors. There's a lot of tooth anchored in the root and it's an involved extraction. It can be a little bit uncomfortable to heal from. If the tooth is already mobile and it's really just tissue holding it in, filling should be in the 1 to 2 range. Dental impressions might be in that 1 to 2 range, and it's not necessarily painful. It's more of the gag or sometimes the uncomfortable feeling of having a mouthful of material in there for a short period of time. Crown prep should be in that 3 to 4 range. Ideally, you're numb for the entire procedure, but sometimes there can be some residual tenderness and soreness because we did have to remove tooth structure and you leave with either a temporary crown or a permanent crown, but the tooth might let you know that it had some work done on it. Dry socket after extraction is a 9 or a 10. That is one of the most painful things in dentistry. And typically with the right surgical procedure and the right processes, those are avoidable. But sometimes just the way the body heals, they're unavoidable, and those can be pretty painful.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on thoughts, the dumbest you've ever seen.